to Can I Have Your Attention Please? A weekly podcast by me, Orla Holland, as an adult female with late diagnosed ADHD detected during the perimenopause. I decided to start this podcast series to help others. I know that there are hundreds of thousands of women out there with undiagnosed ADHD, many of whom will be heading into perimenopause and menopause with no idea of what's about to hit. And hit it will with a bang. So ladies, please send this to all your female friends. This is something we all need to know about. I am here to simply inform, guide, and hopefully inspire you to advocate for yourself and live the life that you deserve. So this week's episode, we are going to touch on misdiagnosis, and I have some very exciting news because this week we have a very special treat. It's our very first guest here on Can I Have Your Attention Please? I am very, very excited, and we will come to that shortly. I do want to mention, as always, you can find me on Spotify under Orla Holland by searching, or I also have a page on Facebook, Instagram, and I'm even on TikTok, and as of this week, on YouTube, because I know some of you are watching and some of you are simply listening. My children are either extremely proud or extremely mortified, and I do fear it's the latter. And I do want to just please ask you to share this with friends, as there's so many people out there with undiagnosed ADHD. I get messages on a weekly basis and a daily basis, and I absolutely love hearing from you. So please do keep the messages coming. And this podcast is really helping to spread the information and to shed a light on an area that is very underfunded, under-resourced, and unfortunately not talked about enough. But as always, I will say I am not a health professional. So all of the opinions that I share on this podcast are my own opinions. But I do take particular care to share any information from very trusted sources, as I understand the responsibility that comes with hosting a podcast like this. And that said, I'm only human, so if I do get something very wrong, please do get in touch with me directly and I will absolutely address it immediately. So, with all of that out of the way, I am absolutely thrilled to introduce you to the very first guest we have had here on the show. Her name is Helena O'Mara, and Helena comes from Limerick. Helena is a psychology student in DCU, and she very kindly reached out to me after listening to the podcast, and we got to messaging. I invited Helena to join me as my very first guest, as I believe her story will resonate with so many of you. So Helena, hello there, and you are very welcome to the podcast.
Thank you, and thanks so much for having me. This is certainly a first for me. I'm very well, very well.
Me, Helena. I think this could be hilarious. Myself and Helena have never actually met in person. This is our first time meeting on the screen. I knew we would hit it off straight away. And Helena, as I mentioned before, you reached out to me after listening to the podcast. Was I right in saying that?
Yeah, you are. I was following you on TikTok, which is a little bit of an obsession of mine, and my stream is very, very ADHD focused at the moment. So yeah, you came up, and I just loved the way. Yeah, I loved the way you spoke, and the way you addressed it. There's a lot of humorous kind of videos, and lots of kind of things about symptoms that are very broad and could be taken in any number of ways. But I just particularly liked yours, that it was detailed and and coming from literature and and your own experience, obviously.
That is brilliant to hear, because I tell you, I know exactly what you're talking about. And like TikTok can get a bad rap, definitely, in terms of people saying, "Oh, you diagnose yourself off TikTok." Well, do you know what? There's no harm if people do, because if you're going to go to your doctor, your GP, who's going to completely ignore you, or absolutely deny the fact that you're after diagnosing yourself with something online. Like, when something is online, it doesn't mean that it's actually not valid. I was very recently talking to somebody who said that some of the resources that I had put on are the actual scales that are used by doctors and in the medical profession. And they downloaded that online, and the doctor was sort of saying, "Oh, you're downloading things online," so I think there's a lot of misinformation out there. But anyway, so that's brilliant. Delighted to hear that. And Helena, I would love you to share your own story in your own words. Tell us, how have you come to have your very recent ADHD diagnosis?
Well, now, Orla, have you got a week for this podcast? Do you think we'll be able to keep people entertained for a week? Yeah, this will be fun. Well, my story, I suppose, starts at the very beginning. I've in school, I often had kind of some issues. I got away with an awful lot in school because I was quite pleasant, and I did really enjoy reading. So I suppose I was quite advanced in some areas, depending on my interest, and really, really, really fell behind in certain other areas. Um, I used to kind of daydream, and I'd be thinking about something completely different, and then I'd entirely miss the question, let alone how to answer it and whatnot.
Yeah.
And so, that went on for all of my schooling. But I think I remember in do my leaving cert, I at that point was I was a bit wild at that stage, and I just thought, oh, there's no way that that this is going to happen. And I made the very wise decision of doing leaving cert applied. And of course, it's very much a practical kind of way of doing your leaving cert. And I know that there's, other kind of things about it that would mean that you can't directly go into university and stuff. But it really gave me a bit of confidence about my learning. And so I've done thousands and thousands of courses over the years, but they've all been relatively short. 2 years was the most that I've ever done. And I've often said, if I combine them all, I could be a doctor now at this stage. But unfortunately, I didn't have the patience. But I suppose in recent times, I started my psychology course, and almost immediately the standard of education is, completely different to what I'd been used to. And so I'd be reading and I'd be saying, oh my God, what is this? What is this? And it could take me a week to read a scientific paper. And I thought, my God. And so there was all those kind of schooling type things. But there's also been a lot of mental health issues and kind of, like psychological issues, I suppose, to do with, the way I am, and, like in my relationships, and, the kinds of things that that have affected that over the years, really. I'm a smoker. One of the years I gave them up actually was a year that I was completely tormented. And looking back, I can safely say that the nicotine was probably, some sort of kind of, it's a stimulant in itself. So, and I couldn't concentrate and I couldn't do anything that I needed to do. But I think that over the years, it was a lot easier to deal with. I suppose when you become a mother and you have a family and you have jobs and you have all these responsibilities, that's when you can kind of go into overload, and suddenly the capacity isn't there to, keep some of the things at bay that you have had all along, So that's that side of it. We can go into the very beginning of the actual diagnosis if you want, which is one of your interests, and that was how I went to a different GP to my own one. I was actually going for Botox, and I noticed that on her website she had this kind of a full health screening thing there. So I said, oh, I think I'll do that now, because I'm very bad to, to keep up with this sort of stuff. And she said to me that, I think you're in perimenopause. And I said, oh, okay. So I had explained my symptoms. I said, I have brain fog, and I'm tired, and I can't concentrate, and I'm depressed, and da da da. And so she put me on HRT. And straight away, everything in my life improved. I was sleeping. I was, like able to keep my routines better. And yourself, if you're sleeping well, everything else in life is going to be 100 times easier. And so I could concentrate better on my coursework. I wasn't as cross with my family as I had been. And when I went to my own GP for something else, I happened to mention that I was started on the HRT patch, and they didn't agree with the idea. So they referred me to an endocrinologist who performed a load of tests and they kind of confirmed
Wow.
that there was nothing wrong with my hormones.
Hmm.
So they said,
The
that's
blood
it,
test
come
they did,
off
Helena.
the. It was a blood test, and I know that there's a lot of issues in that itself. Um, and I was very cross at the time because I had read up about these, the likelihood of picking up, a deficit or a difference in your hormones just on one day. So I said, well, I can't understand this. I said, but if it makes me feel better, why can't you just agree to give it to me and that's it? And we had this huge debate over it. And so I left it alone. And I had the worst couple of months after stopping the HRT.
Oh,
I remember I cried at my computer one day because I could not perform the simplest task. And I thought, how am I going to go back to college in September and manage my life? But that got me back thinking about the ADHD, which has come up and over and back over the years that I've had this thought. And I said, right, okay, this time I'm going to pursue a diagnosis properly. And I did a lot of research, as you know yourself, my own research online, and I have a good understanding of, the psychological aspect of it and stuff. And so I went from there, and here I am. So I'm just going to stop for a minute and let you ask some questions because I'll never stop.
it's incredible, though. Your story is just incredible. And I would say genuinely it will resonate with so many people. And there's so many things in there. I think like the first one, well done to that woman that you did that doctor, that first doctor that you went to that did that full test and highlighted perimenopause. I mean, that was amazing that they did that screening and gave you that. I only wish that that's what we all had as standard. We should all have that
Yeah,
at different stages throughout our lives. Wouldn't it make a huge difference? And the other thing, just to highlight, is the frustration. I can see your frustration and I share it in terms of how doctors make their own decisions. Many GPs make their own decisions, not listening to the patient. It's not patient led. And this needs to change. And it is changing, in slowly. Unfortunately, it's not reaching an awful lot of places. That you were someone who presented whose symptoms had improved as a result of treatment you had been given by a doctor, and another doctor said no. So not only did they not agree with the other doctor, but the most important one is they didn't agree with you. So how do we advocate for ourselves when we're in a position of feeling already quite low, unsure of ourselves? ADHD comes with a lot of imposter syndrome, and the fact that, especially undiagnosed ADHD as an adult, we already, have this mistrust in our own selves, in our own views. We don't even trust our own
absolutely.
opinions. So it's so difficult
Absolutely.
then if you go into your doctor.
Yes.
Yeah. So they wonder why a lot of people aren't getting diagnosed. One of the
Yes.
most common things that people get in touch with me about is the fact that they are gutted when they go to their doctor and their doctor doesn't support them, or elated when they go to their doctor and their doctor does. And it's
Yes. And
just
it's this
huge.
huge
Like,
thing. Yeah.
it's
And
huge. So
and
Helena,
the
what
the
happened next?
influence of the GP. Sorry, yeah,
Yeah.
go ahead.
No, I was only going to say what happened next in terms of how. So you had your background in psychology with your study, which is amazing, and then so you knew, and so you had this sort of suspicion. Would that be right to say that you throughout your life
Yes.
that ADHD was a possible diagnosis? How did
Well,
you go
not
about then
throughout my life,
finding it?
but
Okay,
in recent years, I would say. Yeah, in recent
from
years.
your and was that from your
Yeah.
study, from studying psychology? Ah,
It
interesting.
was yes,
Okay.
it was a combination of studying. It was a combination of realizing the difficulty I was having with study and
Uh-huh.
my slight obsession with social media. Really, that like as we've said before, like to raise awareness is fantastic, but it's really important that you do your own research and you understand your own
Yeah.
symptoms, rather than just
Yeah.
saying, "Oh, that's like me," or "I do that," because
Yeah.
it's important that you get the right diagnosis, whether
Yes.
you have it or whether you don't.
Absolutely. I couldn't agree with you more because it's such a difficult one in that they're all human traits. So but
Yeah.
it's about the frequency and the severity and
Yes.
how much they really affect your life. Like you're the perfect example there of, and I was so similar. I relate to you so much in the short courses. I couldn't ever
Yeah,
put my name down for something any longer because of the fear that I wouldn't do it. I knew I couldn't
I
trust
know, I
myself to
know.
be able to keep that
That's it. You'd
interest
get so
in that
far
area.
and you'd be like, oh my God,
Yeah,
why did I start this?
it's impossible.
Totally
Yeah,
lost interest.
exactly. And people go, I would have talked to various different friends who over the years and expressed that, and they would be like, yeah, we all lose interest, but you just have to go. And it's kind of like, no, it's not the
Mhm.
same as that. It's
It's
almost
not
like you're
the
trying to
same.
drive a car with no tires. Yeah,
It is. It's an
the tires
aversion.
are
It turns
missing.
into an aversion,
Yeah,
not just a,
yeah, it's a
uh,
block.
I don't
Mm,
feel like it. You will do anything
yeah,
to avoid it. you know.
literally anything. So I totally get that. So then, did you go down the route of getting a private diagnosis, Helena? Had you thought about going public, or how did you take the next steps?
Well, I looked at both ways, and I downloaded the app, the HSE app, and kind of had a look at different things on there, which is quite good. It could do it more, I think, in the way of information. But so I looked at that. I can see now that you spoke about it in one of your podcasts recently, that there's some new things happening if you're in different catchment areas, and I looked that up to see whether there was something in my area, and I think in fact there is something new that's after coming around here, but I have some experience with the system from my son, who has a severe intellectual disability, and I kind of thought to myself, well, I'll definitely have lost interest in this by the time that I get to see somebody. So fortunately, I was in a position to look at going down the private road, and I saw a lot of different things that there's a lot of kind of online assessments, and I mean, it's good that there's stuff like this available. But one of the things I did want to say coming on was that it's really, really important to do the research before taking a diagnosis after maybe an hour, which is what's happening
Yeah,
in some cases. And people are so desperate um, to find out what's wrong with them and whatever else, that they will
yeah,
say, or they're so convinced that this is what I have, without
yeah,
really knowing whether it is or it isn't. And I feel that maybe an hour doesn't give an awful lot of scope to get to the bottom of what's going on for a person. And so
yeah,
it's really important, I think, to use an option where there's kind of multiple tests going to be carried out, or multiple psychometric tests, and screening for other things as well.
yeah,
Because as you say a lot yourself, the comorbidities, and there's you know huge crossover in symptoms between
yeah,
ADHD and other like mental disorders and kind of mental health disorders. So you're talking about stuff like
yeah,
even dyslexia that's gone
yeah,
undiagnosed, and loads of similar symptoms. So it's really
yeah,
important that in even though people are in desperation, to make sure that they are
mhm,
getting a really thorough investigation into what's happening for them. Because
yeah,
as we know, stimulant
yeah,
medication, it's a very it's a serious medication, and it's not something that you really want to be taking if you can avoid it. I
yeah,
personally think my whole life has changed because of it. So I'm not saying, I just mean to make an informed
yeah.
decision for yourself.
100%, Helena. I couldn't agree with you more, and I'm so glad you brought that up because there's a definite, there's more than one gap in the system, but that is just in particular a really important one to approach and to talk about,
Mhm.
because what happens for an awful lot of people at the moment, whether you're on a 2 or 3 year waiting list, or you get an assessment online, is that they are only screening, as you say, for ADHD. So
Yes,
they screen for ADHD, and you get told yes or no, and here's the choice of
yes,
medications, and nothing else
exactly.
happens.
And nothing else happens. And you
You're
could
left.
have spent a lot of money at that stage
You will have.
to
Yeah.
just be told no, you know. So my
Yeah.
advice to people would be, is after they've done their, really good research themselves,
Yes.
um,
Yeah.
is to go and speak to your GP and make sure that your GP is on board with a potential
Yeah.
diagnosis, because it's very hard to find a psychiatrist now that's going to keep you indefinitely.
Yes.
So a lot of people are having kind of shared care between their
have that. Yeah.
psychiatrist and GP, and that's what I do. I'm still with the psychiatrist at the moment, but we'll say after Christmas maybe, that'll be all moved over to my GP. And he was happy, but I wasn't 100% sure that he would have been. So I took all of my battery of tests that I had been sent by the psychological services I used, and I said, "Here, look at this."
Yes.
And
here's everything.
I said, I really hope that you're on board with this, and it's something that's very important to me. And he would have, knowledge of my mental health issues, and I had been on SSRIs for maybe 8 or 9 years at that point. And so he said, right, Helena, well, look, go have it checked out. He was like, I'm happy to take over the care. He was like, absolutely no issues. He did the tests that I needed to have done, the ECGs and the bloods and all that sort of stuff. And I sent them to the psychiatrist, and we kind of all worked together. Yeah.
Yeah. That was my experience of it as well. I had exactly the same. Now, mine was online. I will say my own assessment was online, but it was shared care from the start. I was very lucky my doctor was on board, and that was really important to me as well. I had the ECGs done. And it was great because I had difficulty. It took me 3 different medications to find the right one that worked for me. So I needed to have ECGs done all the way through. And I'm still with my psychiatrist and still in constant touch to make sure that if something doesn't feel right, they're the first port of call, So I've been lucky in that they and just from, I suppose, other people that I have met who have gone down a different route, who might have had in person and waited for 18 months or 2 years. I have no difference there was no difference in the care that I was given, from that perspective. And I suppose adult ADHD is a very, all diagnoses are extremely individual. Of course they are. But adult ADHD, by the time we're going in to see someone, we have a fair idea. We've lived with this condition. We've lived with our own minds. We've lived with our own health for a long bloody time. So we do need to be listened to. But I 100% agree that we need to read as much about it as we can. And the comorbidities are really, really important. There's so many overlaps and crossovers. And I am going to put a couple of links because I found some really good articles that help to talk about the various different, and especially with depression and anxiety, because an awful lot. I was diagnosed with major depression when I was 19 years old. I do believe I know I had depression because the antidepressants definitely helped me, and there was a big difference. And I ended up staying on them for most of my life because they were regulating my mood. So there was definitely they were helping, but very similar to you, it was when I started to come into perimenopause that actually the difficulties, I couldn't, I simply couldn't adapt myself to overcome my symptoms anymore. So my ADHD symptoms became exacerbated. And it was only then when I started reading and researching about ADHD that I could look back on my life and go, oh my God, basically. It made sense of absolutely everything, all of the struggles, everything that we went through. But like that, I needed, and I think it was to do, I know I've mentioned on once before, the lowering estrogen in our systems, because dopamine is dysregulated with all of us with ADHD. So dopamine needs estrogen to operate optimally as well. So they're so interlinked. So as that starts to decline, then obviously we have those issues that present themselves as well. And it became much worse. But there is an awful lot of people out there that have been misdiagnosed. Whether it's a misdiagnosis or whether it's, a missed diagnosis in terms of, like in my own case, I definitely had the depression, but what wasn't picked up, or the diagnosis that was missed was the ADHD. I know that there is an awful lot of people out there with the same difficulties, and you had a similar experience in your life, Helena.
Yeah, I mean, it's just like, it's really up to you, unfortunately, to go and research these kinds of things. And I don't mean to be annoying when I say that, but nobody is going to tell you or spoon feed it to you. And the reality is that the world is being overcome with women of our age group, finding out that they have ADHD now. And it's only because, that our symptoms are different. We're getting
Yes.
to, we get to a certain point in our age when, as you say, things become difficult. Our cups become full and we can't do things anymore.
Yes.
And and that's why this is so good, because it needs to get out there so that other people who have spent a lifetime searching for what's wrong with them. I know I have done diets, I have taken medication, I have spent hundreds of euros on different supplements, and I mean, to my own, my close friends, I said, even lately, I said, well, I think I'm just going to have to accept that this thing that I'm searching for, whatever it is, I don't know, doesn't exist, or that I'll never find it. And the importance of actually getting a diagnosis and getting that validation is enough to, I know that I'm not saying that it's a great thing to find out you have ADHD. For me, it has been, because I'm like, oh, well, this is it. This is the thing,
Yes.
And my whole life has changed. It's only been 2 or 3 months now, and everything is just so different. And I'm hopeful about the future because of it,
Oh, I couldn't agree with you more, Helena. You are speaking that's exactly how I felt. And it's like this feeling of relief that all of a sudden I didn't dislike myself as much. I didn't feel like I didn't carry all this shame and this inner monologue that was constantly like, oh, you're no good at that, or you can never do that, or what's wrong with you, or you never, not
and
trusting myself, everything. The stress, exactly, everything lifted. Yes, I agree with you 100%. I know it's not like, oh, I'm celebrating that I have ADHD.
No, I know. But I mean, you always had it as a boy. So yeah.
Absolutely. So it has. And look, we're not alone like that. We know that through the 70s, 80s, 90s, and, noughties, women weren't really diagnosed. Even today, the diagnostic criteria is completely skewed towards that sort of, disruptive 8-year-old boy, and not only is it skewed towards boys and children, and you mentioned, I think it was really important that the diagnostic criteria is quite difficult as an adult as well, because it's not really relatable in an awful lot of places. We'll have learned
right.
that. We'll have,
because you see, it's geared towards children, and we have gone 30, 40, 50 years figuring out ways to to function, and so it's not going to manifest in the same way, or even some symptoms don't appear at all or look like they're there, where they might actually be there. So maybe, I could get an A in a paper for college, but it might take me a month of solid working on that paper to get it, or somebody else would come along and they'd probably do it in 3 days, So, oh, well, look, you can say that, oh, she does fine in education. She doesn't have ADHD, but my whole life has fallen apart in the background, and, the children are starving and the house is a mess because that's all I've been able to do,
Yeah, absolutely. And that is the case for so many of them. I know there's with autism, they often use this spoons analogy where, the people with ADHD and autism have a certain amount of spoons, whereas the neurotypical, they use less spoons to do the task. So by the end of the day, we're left completely depleted. You often find people talking about day sleepiness or having to nap in the afternoon, because we need to use so much more of our functioning to do simple tasks than neurotypicals or people without ADHD. So it can
and all the sleep problems that are associated with it, So
exactly.
You're getting up in the morning, you're already tired because you haven't had quality sleep. I mean, I used to find I could have had 10 hours sleep, but I might have woken up 12 times in that 10 hours. So you're still tired when you wake up,
I feel like sometimes I've performed a marathon, throughout the night, the amount of times I wake up and toss and turn and wake up and toss and turn. I'm more active in my sleep, I think, than I am during the actual day.
Absolutely.
Absolutely. And these are all things, and it's not until after you get your diagnosis that you start, so many things slot into place, simple things that you do, you just thought were quirks or your own thing, and then you're like, oh my God, all people with ADHD do that. That's amazing, or that it's related to your ADHD.
And did you find that once you found out that you suddenly became more ADHD than before? Because that's what I feel.
Yes.
It's
You
like you're
do.
not masking anymore. You're not
Absolutely.
trying to pretend. And next
Yeah.
thing, your family are around you saying, God, I think you're getting worse since, you know.
Yeah. Absolutely. I had a funny one actually, and it was a question I really wanted to ask you because I think this might be of interest to a lot of listeners is, how you share it. When you got your diagnosis, how did you share it with family? And did you then start diagnosing everyone you met and all of the people you know?
I have everybody around me diagnosed with ADHD. I have, to me, I've never had an issue with like telling people anything like that. So I like to around mental health stuff as well. I've never had an issue with telling people that I've taken SSRIs or anything like that. It's good to be speaking about it. So I basically told everyone and their dog that I had ADHD. Now, this is
Same
why
here.
I can't shut up, and it's not my fault.
I love
So
it.
yeah, I told everybody. I had a lot of mixed kind of responses about it,
Responses.
as
Yeah.
yeah, as I'm sure
Tell me
everybody
more
has
about
had.
that.
But
Tell me about some of the responses that you have had.
well, there's the oh right, okay, but sure, aren't we all a bit like that, And I mean, everybody talks
Yeah.
about this, You've mentioned it, loads of people have mentioned
Yeah.
it, And as you say, it's yeah, but is every minute of your day like this, And I kind of feel that for people that kind of come at you like that, it's not really worth getting stressed out over and trying to explain everything that you know about ADHD. You can try if you want to, but I'm not sure that it's worth your own sanity. And then a lot of people were like, well, I could have told you that a long time ago. I'm like, well, why
I
didn't you?
love it. Yeah.
But
I know.
yeah, so yeah, mixed responses. A lot of people, some people have been very caring about it, and have
Yeah.
offered loads of advice and different things. And there's a lot of ADHD out there that we don't
Yes.
realize. There's a lot of it there.
Yeah. There is. I couldn't agree with you more. And I followed a very similar path to your own, Helena, in that I go out for a pound of butter and come back having told five people, even if they didn't know me, that I had ADHD, and couldn't stop talking about it to people.
Yeah,
And
yeah.
I definitely found a mixed response amongst friends and family. I had to do a lot of gentle explaining, and I actually
Okay.
went to see a fantastic psychologist in Galway, who came highly recommended. She was brilliant. She was the lady who used that expression on her dopamine, and it was one of the best pieces of
Yeah.
advice she ever gave me, because she was like, if you don't, it will honor itself in whatever way it wants. And she was so right.
And
But
she is
I
right.
talked to her. Yeah, I talked to her about talking to other people, and close family and friends who I could tell were not as open to it, but were being polite and listening and things like that. And
Yeah,
she said very similar to yours, Helena, in that don't waste your time or your stress on trying to
yeah,
bring them around, because it's not worth it. Unless
exactly.
it is, unless you need to. I did go and
Yeah.
see a seed talk with my husband. I actually told him that we were going to Dolan's. I said I have tickets for Dolan's, and forgot to tell him it was for a seed talk. He thought it was to go and see one of musicians. Actually, he found it excellent. He found it really,
Good,
really
good.
helpful. It was done very well. So yeah, there is, and that was important to me because he's my husband.
Yeah.
So he just hadn't been
Well,
exposed to it. He
that's
didn't know
yeah.
much about it. And for a lot of people, that's the case, and it's just a
Yes,
case of trying not to overtalk, trying not to overshare,
I
trying,
know. I
to
know.
and trying to put myself in their shoes, and
I
have
know.
that empathy to help bring them along, because
Yeah.
some people, it will be important to you that they're on board and they're worth fighting for. But yes, as 100%, as you say, for the others. But I love the fact that you're talking about it and that you're out there, and I'm doing exactly the same. And I'm hoping that by
Yeah.
doing that, other people will see themselves in us and recognize,
Well,
themselves and
this is
different
how
things
it
that they're going
happens,
through.
isn't it? It is.
Mm.
And I mean, just to get somebody going and think, right, that I'm going to look into this, I mean, it's not like
Yes.
saying, oh, that's me. I'm the very same. I mean, look into it and see, and, then you'll
Yeah.
really find out whether you need
Yeah,
to go further or not,
absolutely. Exactly. Do the research. And I know, like, the symptom checkers and the symptom trackers, So every GP will react to them differently. I've had a few people in touch this week to say they had downloaded them and filled them out and brought them. And some GPs were delighted and it was brilliant. And others were like, as I said, that's online. But actually it is the scales that are used by, CAMs in Ireland. But,
Yeah,
I think regardless of whether or not you're bringing them to a GP, for yourself,
well, this
exactly
is
as you say,
it.
do that research, read as much as you can, and keep an eye on it for yourself. When you become that self-aware, it's never any harm. But it also will really
Exactly.
help you to believe in yourself and to advocate for
Yeah.
yourself, because that's
Advocate
the
for
most
yourself.
important thing that you're going to need. Yeah, exactly.
And I mentioned to you
Yes.
in the message yesterday about the diagnostic, excuse me, the diagnostic criteria in the DSM. And
Yes.
most of the scales that we use are based on DSM criteria, and because it has such a
Yes.
big weighting in health and mental health. But it's important to kind of see that the way the symptoms are laid out in that for people with ADHD are not actually symptoms, they're consequences of behaviour. And so
Yeah.
it's really difficult for somebody to look at those and, if the criteria is that I'm always late, well then if you're not late, then that's one thing you're not meeting. Or if you're not disorganized,
Yeah.
or
Yes.
personally, I'm never late for anything. I'm pretty organized,
I'm here.
and so easy then for you to think to yourself, oh well, that can't be it. Then that can't be right.
Yeah.
Other disorders, um, they have actual tangible symptoms.
Yes.
Being late isn't a symptom. And
Yeah.
that's really important to recognize. And I think even for like GPs and everybody else to kind of
Mm-hmm.
understand that
Yes.
like I'm never late because they say people with ADHD run off of adrenaline for a deadline. Well, I used
Yes.
to run off adrenaline all day long because I was terrified that if I didn't get all this done today, the whole thing will fall apart. So I ran on
Yeah.
adrenaline or on a deadline every single day. And
Yeah.
so I was organized and I was not late. And, I did not appear as somebody that had
Yeah.
ADHD, apart from maybe that I was very talkative and, impulsive and stuff like that. So, to understand for yourselves when you're looking,
Yeah.
at the symptoms out there, to kind of really get into what the symptoms are, not what the consequences of them are,
The fantastic one, because actually that time blindness that they talk about, everyone just assumes is, are you late? And in fact, that's incorrect, because time blindness is
Yeah.
an inability to determine how long something is going to take. Because I'm actually chronically early, and I
Yeah,
suffer from a lot of
exactly.
stress around getting to appointments. I am that person who will be outside for 45 minutes before the appointment is due.
Exactly. That's
I've turned
exactly.
up too early for flights. Yeah, I've been turned
Yeah.
away. I'll never forget it with Ryanair. Too early to check in for a flight. Yet my sister, who is currently actually about to, she's on a waiting list to get her diagnosis, but she is she's promptly late, for absolutely everything. And it's not, and I've seen that. I've lived with her for years, and it's so funny, like the stress that I start to feel when, approaching something, we need to be there for 12, and she'd be looking at me going, why are we leaving at 10 past 10? We don't have to be there till 12. And I'd have to agree with her a time we could leave her, because otherwise I'd actually feel ill, with such stress
Yeah,
around the time.
absolutely.
That's
Yeah.
time
And
blindness.
that's
It's
that
the
is time
inability
blindness.
to determine.
Exactly. Yeah.
Hmm.
Yeah, exactly. People who can gauge
You're
time
so
get there
right.
on time.
Symptoms.
You know?
Yeah.
Yeah,
Yeah,
so
that's really, really interesting. Actually, really, really interesting point. And I think that's it's very important in terms of this, because I suppose the whole idea, when certainly in starting the podcast for me, is trying to help those people out there who may not realize that they have ADHD, and they're trying to find the answers. You put it so well, Helena, when you were saying you were searching in your life, you knew there was something. I was exactly the same. I can relate. So
yeah.
there are people out there, men and women, and I know this is, I can only talk about my own lived experience, which has been through
Yeah.
menopause. So that's why I this is mainly directed, I guess, at, women and women of a certain age. But there's plenty of men out there and their testosterone levels are dropping as well. Their hormones are dropping and they are going to have an exacerbation in their symptoms and will have had difficulties throughout their lives and be searching for something. So there's so much more I know that we could talk about in all of
I
this.
know.
I'm going to come towards wrapping it up, Helena, but before
you'll have to, because
jump over to stay here all day. Is there anything else that you would love to get across, or anything you would like to say to people out there who are listening that, you know, maybe thinking, do I have this? What is wrong with me? You know, could this help?
I mean, I've said it over and over, and I'll just say it again. Keep reading, and, you know, or if you can't read, you know, if you can't sit there and read, watch the videos. You know, like, what's that doctor? Dr. Is it Barkley?
Yes.
Yeah.
I'll put a link. Don't worry, I'll put a link after.
Some fabulous shorts in there, even, you know, if you just don't have the concentration to keep listening, and just keep looking, and the impact that it could have on your life to find out and to, you know, to get the appropriate treatment is just, you know, it can't be overstated. You know what I mean? So for me, anyway, you know, I'm hopeful for the future, and I'm optimistic about my life for the first time in a very long time. And, you know, that could be anyone who's similar to us, you know.
Oh, that is just brilliant. Absolutely brilliant. Thank you so much, Helena. I echo everything that Helena has said. And it is that hope, and it is that the fact that it was a rocky road like yours, and it had a lot of, you know, false starts, and there was certainly bumps on the road to finally getting the diagnosis. And even then, you know, titrating through the medication, that took a good 6 months. And even a medication didn't work for me, the gut-wrenching disappointment that and having to go back and start again was hard, but worth it, because at the other side of that there is hope. I feel like myself again. I feel like I can function and I can take things on, and I just feel like my old self, which is all we were really looking for. So, Helena, thank you so much for joining me on the podcast.
Thank you so much for what you're doing. I really urge you to keep going, and you know, it's going to help a lot of people. And you know, someday when you're, you know, really, really popular for all this, I'll say I was your first guest.
Oh my God. Do you know, I do have to say the most important thing about all of this is the people that we are helping. And genuinely, each message that I get, it just makes my heart sing, because that's what this is all about. It's a lonely, bloody road, you know. There's a lot against us. It's an uphill battle, but at least doing something like this, hopefully, you know, one person listening will go, oh my God.
Exactly.
And they'll,
one person,
you know, decide, and they'll decide to do something about it. And that's all we're here for. So thank you so much, Helena, again for joining us.
Great.
You look after yourself, and we will keep in touch.
I will.
And,
we will definitely.
We will talk to you soon.
Thank you so much,
Helena, and thank you, everybody. Bye, everybody.
Bye.
Thanks, Helena. Bye.
Bye.
Now I think that is stopping